A lot of the wounds that we see are multifactorial, which is part of the reason that having a multidisciplinary team to evaluate and treat these wounds is so important.
Yeah, and I think at the Penn Center for Wound Healing and Reconstruction, you know, as I mentioned earlier and Dr. Jackson mentioned, is that we have a full parade of folks in a multidisciplinary setting. We have Dr. D'Angelo Antonio, foot and ankle surgeon, vascular surgery, myself as a plastic and reconstructive surgeon, infectious disease physicians, cardiologists, infectious disease physicians. Basically, we have this team in place that can address the multimodality needs of these chronic wound patients. There's really no one person who's going to be the appropriate person to treat all wounds. We need someone like Dr. Jackson to address the vascular inflow. We need someone like Dr. D'Angelo Antonio to make sure they have appropriate shoe wear and care for their foot wounds. We need folks who are trained in infectious disease to help treat their underlying infection. And I think we need someone such as myself, a plastic surgeon, to help reconstruct those wounds. So what the Penn Center for Wound Healing and Reconstruction does is really put all those folks under one roof and in one place. So you can see Dr. Jackson, you can see Dr. Angelo Antonio, you can see myself, you can see our infectious disease physicians. We have hyperbaric oxygen therapy available and hyperbaric physicians. So, you know, what our idea was and what we've done is put together a center that has all these specialties that are integral in treating patients with these chronic wounds under one roof. And that's why really a specialty center where you have each individual expert able to see and assess the patient and really weigh in on their own area how to treat the patient is why we developed this specialty center.
The other added benefit that we offer really is having a combination of orthotists, diabetologists, endocrinologists, as Dr. Kovac said earlier, you know, infectious disease. And it's not just you make one appointment and then you have to kind of wait 3 months to be seen. You're seen right away, immediately, and everyone comes in a very quick fashion to address aggressively, as Dr. Jackson said, to get everything under control, because the real cause is these wounds are multifactorial, which is key. It can be from nutrition, so you have to be seen by a nutritionist. It can be seen combination from circulation. And so you're not waiting for months upon months to get an appointment.
The idea behind the center was really to sort of put everything that a patient with a wound would need under one roof. So they come see us, and I think sometimes having a patient with chronic medical problems or a chronic wound, some folks can get discouraged because it ends up seeing multiple providers on multiple different days. And what we've sort of done is make it one-stop shopping. You can see your endocrinologist, you can see your foot and ankle surgeon, you can see your vascular surgeon, you can see your plastic surgeon, all in your visit. It may be a little bit of a longer day for the patient, but you can certainly see everyone in one day, and we can see the patient, evaluate them, sort of get a very reasonable plan for treatment in place to go forward.
The simplest way to think of it is a one-stop shop, in essence. You can get the images performed that same day. You can certainly do other testing right there for you and have the supplies that were needed to address the wound, whether it's temporizing it for that moment in time until if it needs surgery, for example, and then we can move forward.
Right, and I think the one thing that does help make the Penn Center stand out is that we have a team of plastic and reconstructive surgeons who are able to address literally any wound from head to toe. So it doesn't matter whatever part of the body, we have the resources and expertise to deal with it.